Hi, everybody. Thank you so much for being with us. And we have a very special guest today to speak about the private sector and how the private sector can support in this pandemic to the public sector. And our guest today is Jörg Rupp. He's head of 7 areas pharma Roche. So, muchas gracias por estar con nosotros, señor Rupp. Es uno de los gerentes de la empresa Roche. Thank you so much for being with us today.
Thank you. Looking forward to conversation, Glenda.
Yes, and my first question is, what exactly from what you have experienced all these months? I mean, everybody has to change, and how did Roche has had changed? What are the changes that you had to do in order to adjust to the pandemic, and what is the collaboration that the private sector you think can give to the public sector?
Maybe allow me to frame it with a personal story, Glenda. I think I'm working in healthcare for almost 3 decades, and I was super positive. I'm making a contribution every single day. But I think COVID is kind of a big wake-up call for all of us. And so reflecting on this, I really was wondering if we're doing enough. And all those improvements we made over the past years and decades, they feel very incremental, because I think it is clear that COVID has a major impact from an economic perspective, from a health perspective, on every person currently. And so I think what happened to me, considering the situation and thinking, wow, this is really an opportunity to do things differently. And I think I'm saying this because I've discussed this with my colleagues in Russia, and I think we all came to similar conclusions. And I think that also is the passion that we all have around patient outcomes and improving systems. I think for us as a company, as a private company in healthcare, COVID is a real test. As everybody else, we work from home, all of us, in all the countries, all the 80,000 employees around the world. And we still need to deliver the medicines to patients and to deliver to the countries and deliver our tests and our treatments. And so it was a real challenge to continue to do what we regularly and dealing as individuals with the crisis, with our families in exactly the same way, and the impact we all had. To your question about what I've seen or what we see as a company is, I think there is a tremendous will of everybody to come together to resolve this. I think previously there were elements we're not speaking to each other, but I see a clear openness how we come together and how we engage and looking for solutions. These are very simple things like, how do we ship medicines to countries at times where borders are closed and no airplanes are available and transporting goods, up to how do patients get to treatment in hospitals while we have lockdowns. And so what we really saw is a tremendous openness by everybody, by governments, by healthcare professionals, by industry, to come together to look for solutions. I find it fascinating, and I think that's an element we should build on moving forward.
I'm glad you mentioned these opportunities. What can be done better from your point of view, from your experience? What would be your advice to the public sector, to the governments?
I think there's a couple of things that come to mind. First of all, I think the mindset that healthcare is an investment and not a cost, I think is one that is important to recognize. I think what we're looking at is we're looking at health as an intervention if someone turns sick, and then there's a cost associated. But I think we look at health as a good that provides socioeconomic development, that provides economic development, as well as probably security in a certain way. Health has a much bigger impact beyond just what we consider health and having to treat patients at the time. And I think this mindset that this has a much broader impact is one that comes to mind. The second one is around the importance of data. I think COVID has shown us if we would have better data to take decisions, data to track patients with the tracker systems and so forth, I think we realize that this is really one of the challenges. So the commitment to build data systems that are interoperable, that speak to each other, and we can exchange data within healthcare systems of countries or across countries is very important. I think, first of all, it benefits the patients. Patients in their journey have a much greater say if they understand the data. It helps governments to take better decisions. It helps to conduct research and so forth. I think there's really this commitment to a data environment. And we can clearly see that there are parts of the world that are well advanced that benefited from this, if we look at some of the countries in Asia, for example.
Is there anything else from your point of view, as one of the most important heads of Roche, is there anything that you think you need to do better, thinking about patients, thinking about the people especially?
I think it's a very good point. I think what we do, we need to put the people in the center of the way we think. That's very clear. And we need to think about outcomes. I think healthcare systems have really been looking at, if you want, more into a volume-based. I'm saying volume-based in terms of the number of procedures we did, the number of tablets we use. And so I think what we need all to do is to make sure we're looking at real outcome measures. And I think as a company, we really put this in the forefront of what we do. We have turned our organization upside down over the past 2 years to make sure we're thinking this way and we're following that path.